You may be aware of some people in the cosmetic surgery and medical beauty industry getting their knickers in a twist because beauticians have recently attended an advanced course in anatomy where they were able to train on bodies donated to medical science. Because GoodSurgeonGuide is pro-choice and we understand some of our followers do choose to use beauticians for their treatments, we came along to find out from the woman at the centre of the storm just what is going on. Thank you very much for inviting me and my cameras into your, what do you call this, an office, a clinic?
At Cosmetic Couture, we're a registered college. We're also an academy that delivers accredited courses.
Accredited by who?
CPD.
And for my audience, who are CPD?
It's a well-known accreditation company that accredit courses, and every course that we deliver is accredited.
So when you say they're accredited courses, does that include, for instance, and for the sake of argument, are they the same people who are accrediting other training schools that nurses and doctors attend?
Possibly, yes, but I'm not too sure. Can't comment on other companies.
Okay, so tell me, how one of the biggest criticisms that's sent you in your direction is the fact that you are not able to deal with adverse reactions. How do you deal with that?
Some of the arguments, and I've seen a lot of it on the internet, is that we can't deal with adverse effects, but without knowing what Cosmetic Couture's training entails, it actually is a big part of our training. I understand the debate that people say, well, if you're doing injectables, you must be able to follow it up. We actually do follow it up. We do have protocols in place, and we work with clinical oversight who are there to mentor the aesthetician once they've done the training, but nobody asks these questions.
And what other questions do you wish people would ask you about your training?
I wish people would ask about the training, about remote prescribing, about face-to-face prescriptions. I'm very well aware that remote prescribing was banned in 2010. You can't remotely prescribe. I get this. The medical decision needs to be made by a GMC or NMC or GDC registered professional, which is what we do at Cosmetic Couture. We don't do anything that would put the client at risk, not a patient, because we're not medics. We don't do anything that puts the client at risk.
Okay, well that's good to know. So how do you get your Botox then?
To obtain the botulinum toxin, a face-to-face prescription must be done. So that will give an audit trail of where it comes. It will go through to a pharmacy, which will be sent out for that particular client. Then you can treat the client. So initially, the prescriber will do the face-to-face prescription, and they'll do exactly the same for a non-prescribing nurse also. She can't prescribe either.
See, and that's another thing that I'm often told is that because of the remote prescribing laws, it's incredibly difficult for beauty therapists to get their Botox, and therefore it could have been purchased online. What would you say to that?
For other beauty therapy, I can't comment on other people's training. I can only comment on Cosmetic Couture, and we have an association, the ACPB, which was set up to help the therapists, to give them ongoing advice and support. And within that network of people, we do have medical professionals, 17 to date, who are insured to prescribe to non-medic, which is beauty therapists. And they have a protocol and something to abide by, which is to make sure that, we don't prescribe irresponsibly. Nobody prescribes 10 bottles of Botox. It's not, it's to treat that client, and every time that client needs to see a prescriber, it's to make sure if anything medically has changed. If something medically changes, then we then put our prescribers at risk, and we wouldn't do that. I wouldn't do that. So I can't comment for what other people do. I can only comment for what we do.
Thank you. Now, the term beauty therapist, I have to say, that really does concern me. And perhaps that's one of the reasons why I'm here to talk to you and to find out directly from you what sort of training your beauty therapists go through.
As a beauty therapist, I think that people's perception of it that they do nails, they're hairdressers, but there are actually different routes to beauty therapy where beauty therapists work alongside other medical professionals because their whole education is built around the skin, anatomy and physiology. As a tutor and a teacher of anatomy and physiology, we focus on the skin and, about the underlying anatomy. So I don't it's hard when you hear people talking that beauty therapists are thick, they're uneducated. This isn't the case. A lot of beauty therapists go on to do semi-permanent makeup, they go on to do laser, they go on to do scalp tattooing, medical tattooing, they work in medical hospitals such as Finishing Touches. They're one of the big companies that actually work alongside hospitals because they're known for their high standards of training and how they work. So I just don't feel that people get what beauty therapists or advanced aestheticians, as I like to call them, actually do.
That's what we were talking about off camera earlier. You were saying that there is a huge difference between the sorts of people who are coming in, who are graduating from your college, which is that they are advanced aestheticians.
Yeah, I mean, also, you know, I think, for example, here's an example. A phlebotomist who works in the hospital takes your blood. She has no medical background. So when you're going and you're having your blood took, you're having it took by a non-medic. Did you know that?
Well, actually, no, I didn't. I always assumed it would be a nurse, maybe a basic level nurse, but no. Certainly. So tell me, what sort of level of training or education would one need to, a therapist, a beauty therapist need to have in order to even start your courses?
So the minimum entry requirement for beauty therapists is level 3 beauty therapy, because in a level 3 beauty therapy they've covered more advanced anatomy and physiology. Having studied anatomy and physiology at uni, I can obviously say that it's on par with the level 3.
Am I right in saying, or did I read correctly somewhere, that you're actually a teacher?
I'm a teacher.
You're a trained teacher, you're a qualified teacher.
Yes, I'm a teacher.
So you are obviously qualified to teach people, and that's what you've chosen to do this in the aesthetics industry.
Whether I've taught in the sports industry, whether I've taught in the beauty or aesthetic industry, I've been a teacher for a very long time.
No, and that's good to know.
So beauty therapists at level 3 have to cover facial electrotherapy. So this is different currents, hair removal by electrolysis. And electrolysis back in 1979 was actually classed as some form of medical qualification, and the students that used to do the training with City and Guilds back then had to go to talks and lectures on cadaver dissection because of the, you know, electrolysis is quite, it could be an invasive procedure. So there is more advanced treatments leading on from level 2 where you're doing manicures, nails, but even though you do your manicure, you still have to look at the structure of the hand, you have to look at the nail, you have to pass A&P exams, you know, and then it goes on from there. And after you've done level 3, you can go on to do semi-permanent makeup, different things that are more invasive.
Okay, and are there any treatments that you wouldn't do?
There's lots of treatments that I wouldn't personally do.
That you don't train, that you don't teach?
No, because I don't feel certain treatments, treatments that carry more risks.
Such as?
Temple filling, wouldn't touch them. As experienced as I am, I wouldn't. There's certain things I wouldn't do. If I feel there's something I can't do, I just wouldn't do it. I wouldn't put anybody at risk.
Okay. And do you think that the training that you offer here is adequate? In your heart of hearts, have you ever had any complications, for instance?
The training that I offer here at Cosmetic Couture, hand on heart, I feel is of more than adequate standard.
I know you feel that way,
yeah.
But what I'm trying to find out from you is, okay, for instance, what's your complications rates?
None.
You've never had any
I've
complications?
Here at Cosmetic Couture, complications as in bruising. Bruising is normal. You know, if you're having injections, you've got to expect that you could have a bruise. Infection rate, 1 in 7 to 8 years, which was dealt with, which is fine. I can't think of anything, and the insurers will back me up on this, that Cosmetic Couture has never had any claims made against it. I have never had a claim made against me. I've never had any serious issue arise, and with the ladies that I've actually trained, there has been no claims made against any lady that I've trained, and I've trained hundreds.
And that leads me to my next question, actually. What sort of ongoing support do you offer the ladies as soon as they've left your training, your college?
The ongoing support after, once they join part of our association, the ACPB, we have protocols in place, and part of that is that they have to renew the first aid anaphylaxis every year, which is delivered by a nurse here. That's done. If you don't do it, we notify the insurance. It has to be done. Adverse effects, we're constantly adding things to our you know, manuals and files what we get sent in, and what, not from the girls that we've trained, but people who actually send things in across for us to look at, because there's many bits of work, of other people's work, that I have actually done and corrected. And I won't name the professions, but I have corrected work and I have document and evidence of this. And the girls can carry on with their own CPD here, so they never actually really leave. It's hard to get rid of them, so they're constantly in and out. We are a very busy clinic.
Well, sorry, can I just recap a second? Did I just hear you say that you sometimes correct the work of nurses and doctors?
I didn't say that I corrected, I said I did. I'm not going to say who, but I have corrected a lot of work, and I have obviously lots of documented proof of this.
Okay. Well, it'd be interesting to see some of that, because obviously you know that
well, there's a file there. You can have a look at it when you leave. You can take it and have a look.
Thank you very much. We'll take you up on that offer, because one of the things that is always being levelled at beauty therapists or advanced therapists,
yes,
is that a lot of your work, because of you and because of the people who you train, there are a lot of people out there who have a lot of complications.
Where's the proof? Where's the proof of this? Is there any claims that beauty therapists, I can't talk for other companies, but for my company, I've not yet to see some evidence of this.
Well, actually, to be completely honest with you, and to be fair to you as well, it's just the whole beauty therapist tag, and whether Cosmetic Couture are delivering into the industry educated, well-rounded, knowledgeable aestheticians, or whether it's somebody else who is sending through, or
well, I can't talk for third parties. I can't talk what their training structure is. Our training is definitely not one day's training. It can go on for months. There's pre-study in place that they have to do before they even come on the course. There's also the assessment process. As an assessor, we have to assess the students practically, case studies after it, oral examinations. If they don't pass, they don't pass.
What's your pass and failure rate? I say out of every 100.
I would say probably about 90%.
Fail or pass?
A 90% pass rate, 10% fail, which they'll carry on with supervision.
Okay. And how long is your training from the first day they walk through your doors to the day when they leave, ready to go and be paid to inject people's faces?
It can carry on for up to a year, because they're still doing case studies. They're constantly coming back. Girls will come back and do refreshers, but part of the ongoing support and advice after it is that they get 16 hours CPD per year, because of how busy we are as a clinic. You know, as an add-on to the actual college, we have a lot of models, and there's a lot of people coming in and out of this clinic, you know, most of the time. And like I said before, we don't really have any problems, and I'm sure most of my clients, well, all of them, would back me up that, you know, that they like the structure of the college and how it runs, and how, you know, the standards are set of the training.
The cadaver training, how do you feel about the reaction to you attending the course?
The course that we attended, I feel the backlash is totally uncalled for. I think it's been mixed on the media. It's not correct about what we actually did.
What isn't correct?
What's not correct about the course is about prodding and probing and injecting substances into people who've donated their bodies on the donor programme.
Okay, so did you prod, did you poke, and did you inject?
Didn't prod, didn't poke, no.
Did you inject?
We did inject, like this video. So to suggest that we're prodding and poking at, you know, the face, and it was purely about that, it wasn't. It was about the whole human form, about looking at how the body works and functions, which is a large part of the course contents that we teach within our college structure. So looking at this video, some of the media said that it should be used for medical science. Now this is an IMCAS video, and it shows a link up of a cadaver with a surgeon, and you'll actually see a treatment being done at the same time. And their reason behind this was to show what would happen with adverse effects. And this sort of, like, I would say, gave me the idea to maybe to try and put something together like this, because there isn't much out there for beauty therapists. I'm trying to do it for the good of the industry, and we do know what's underneath the skin, but we were looking at to see, you know, if you hit the angular artery, whereabouts was it? Because it's not always what it is in text. So it wasn't done in that way. This course was treated with the utmost respect, and I don't think that's being put across in the papers. It's not fair. So you can see the cadaver, and then it'll link up now to maybe a doctor that's doing that specific treatment, so that the doctors and nurses can look at the underlying layers of the skin and see, did they hit a vein, did they hit the angular artery, which is one of the hotspot areas. And I think this is a lot of what say for instance Raj Grosvenor has brought up about dealing with complications. One of the severe complications is necrosis of the skin, and this is when it's quite rare, but a lot of our training is based around this. So if you block an artery, you stop the oxygen supply, it can be quite devastating to that client. So you need to know where these areas are, and you also need to be able to reverse it with these hyalays, which is something that we offer. We do actually offer this.
Where are you getting your hyalays from?
It's prescribed. It's prescribed face to face. So if in that rare case, the only way that you can have it remotely prescribed is if it in emergency situations, and that's the same for a non-prescribing nurse. She will have it in an emergency kit. She'll have a first aid kit. She'll have her anaphylaxis. So she's got her EpiPen. She'll have hyalays for emergency situations, and this is all in place. They also need to have antibiotics prescribed by your prescriber if an infection was caused. Again, it's quite rare, but if it happens, you need to be able to follow it up. If steroids need to be prescribed, they need to be followed up. So if you are doing treatments, you have to follow it up, and that's what we teach. You have to follow it up, otherwise don't do the treatments.
And am I right in saying that this is all part of the many manuals and protocols that you have in place? Yeah,
we've been doing this for over a year, which is why we agree with Sir Bruce Keogh, the standards, everything that was set in place. Number one, meet accreditation. Work with clinical oversight, work in a clinical environment. Don't do mobile. I don't like mobile. It's not right. You're not in that correct environment. If you're based, you should have everything in place, and you should work with other healthcare professionals. Why not work with them? Make it safer, rather than, there is companies that are doing things that are not right, and I really can't comment on that. But there's a lot that goes on in this industry, and there's good and bad in every industry, and I'm certainly not bad. I'm not.
Well, I have to say, in coming in here, I honestly believed everything that I had read and everything that has been said. But having listened to what you have to say, and having looked around the clinic, and having read through all of the manuals and all the protocols that you've clearly taken a lot of time to put into place, I can't agree with a lot of what's being said. However, personally, I still, as a personal choice, and we've discussed this previously, I would only ever use a nurse or a doctor for my treatments. But how would you change the mindset of someone like myself who would only use a nurse or a doctor for their treatments?
I could never change the mindset of you unless you was to spend 2 weeks in here and watch what we do and how we train, look at the results, look at the clients that come in. I've been doing treatments for 8 years. I've been teaching for 4 years. So I'm very experienced in what I do. So I'm always going to come across criticism, and I don't think this debate will ever end. The Keogh review was put there to look into the industry, PIP implants, everything, who was doing things right, who was doing things wrong, and it was supposed to make it fair for all and to protect the end user, which is the public. Now, a lot of people feel that it was a waste of time. I don't, personally. I think that it's been unfair that beauty therapists have been brought into this industry by medics, by doctors, nurses, dentists.
That's a wide claim. Are you trying to say that it's the nurses and doctors' faults and surgeons' faults for bringing the beauty therapists into the industry?
I'm not blaming anyone, but what I'm saying is doctors and nurses obviously trained beauty therapists originally to come into this industry. So if there's beauty therapists doing treatments, who trained them? Who originally trained the beauty therapists?
Do you know, that's a question I had never actually pondered. I think I had assumed that they were self-taught or self-trained.
No, I was trained by a nurse. My whole entry into this industry was whilst I was studying at university on my sports science degree. I seen an advertisement in the paper, and it said there was a course being offered in Warrington, Dalham Court it was, and it was by a company called the Academy of Cosmetic Training, and her name was Tracy Mehag.
And Tracy trained you?
She trained me, and when I went on the course, I went to do the botulinum toxin course, I went to dermal fillers, very excited, loved, you know, I was into the whole anti-aging, and I thought, wow, I thought it was just for nurses and doctors, fantastic. So being gullible, I used what money I had, went on the course, sat down and thought, this isn't right. And I thought, I'm here. Anyway, I went up ahead with the course. She was actually quite a good teacher. Really enjoyed it. Did the training. I come away, straight on the internet, having a look. And then I thought, oh my God, what is this minefield that I've come into? But being the type of person that I am, I questioned her. I questioned many people. So she eventually shut the company down, possibly due to me questioning about this and that. And back in the day then it was remote prescribing, so you could remotely prescribe. I had a lot of clientele because I had a beauty salon as well at the time, so I thought, well, I'm going to have to educate myself here more. And then I come across lots of other people who were like me, who had been trained by medics, 1 or 2 days training, that was it, you didn't see them again, and you were left in this big industry on your own. So I started to do every course, and I mean probably about 163 to date, from phlebotomy to tattooing to I started my teaching qualifications. I did other qualifications. I did more beauty related, because my entry point into it was because of anatomy and physiology from university. It wasn't a beauty. That's how I actually got into this industry.
Question: did you use any cadavers when you were doing your anatomy and physiology in university?
In university, no, we didn't. No, but we looked at the structures and in great depth. So we studied kinesiology, we looked at origins and insertions, we looked at biomechanics, how the body works. And as a professional athlete, my whole life was dedicated to nutrition, to training, how the body functions, how it works. So to do the dissection courses was a personal interest of mine. I am passionate about A&P. You know, it's just, I was brought into this industry, and I just thought, well, what can I actually do? You know, I've been brought into it by a medical profession, and then it's this same person that's trying to stop me from doing the treatments. Why do it? Why take my money? The whole thing about the cadavers is that the course, first of all, I have to stipulate, was treated with the most respect. At no point was anything, untowards. The tutor was excellent. No questions weren't answered. The donors, we thank them for that opportunity to actually to discover A&P, but I don't understand why that we're getting so much backlash, because as a teacher, all I wanted to do was further myself and do more CPD, and to pass that on to the students. I thought that the whole industry wants safety in it, and this, all I'm trying to do is to make better training for people that are in the industry already. They're in it. They're not being stopped. It is not illegal for beauty therapists to inject Botox, botulinum toxin. But what is illegal? It's not actually illegal. It's a guideline. It's a GMC guideline that you must have a face-to-face. And as a beauty therapist, we're not actually regulated by the GMC or the NMC, but we choose to abide by it because it makes sense. It makes sense because we are not trained to make the medical decision. Every day we do consultation forms. We know about certain medications that thin in the blood, anything that coagulates the blood. We know this, we understand, but there's certain things that we don't know, and that's why we work with clinical oversight. We're happy to do that, but I can't comment for other companies.
Thank you. So one of the criticisms that's always levelled at beauticians is that you stockpile Botox. Now, what is your response to that?
As far as I'm aware, beauty therapists don't stockpile, but then again, that could be said for any profession, a non-prescribing nurse. What I teach is that each client must see the prescriber face-to-face before they actually have the treatment done, and it's then prescribed and it comes from a pharmacy. So I don't understand why they could stockpile. I don't get that.
Okay.
But what I can say is that also within our company that we adhere to PO's review. So we actually work with NMC, GMC or GDC registered healthcare practitioners who prescribe. They've worked with us for many years. they understand that what we are doing is in line with the review, and also in accordance with their own rules with GMC and NMC. So we're not actually doing anything wrong. We're trying to make things safer and better, and you can decide yourself. You know, I'm not gonna, you know, I can't please everybody, and you'll have your own decisions on that.
Okay. Well, Maxine, I have to say thank you very much for seeing me. Thank you for letting me take up your time this afternoon. And we'll let everybody make their own decisions. So there you have it. My opinion hasn't changed much, but because it all boils down to research. One thing I can tell you though is Maxine is incredibly passionate about the quality of training that she offers here at Cosmetic Couture. If you do decide that you are going to use a beautician for your treatments, please make sure you do your research. Look at their past body of work, speak to their clients, find out everything you need to know about not just the individual that's coming at you with an injection, but about the products that they are using on you. Stay safe. Stay beautiful.